Now, I know a lot of people do not like their belly fat. It doesn't look good, it gets in the way, but you have to realize that this belly fat is the tip of the iceberg. There's a lot more going on behind the scenes, okay? Then that's what I'm going to talk about. So, yes, it doesn't look good, but let's talk about what's really happening on the inside of your body. For you to have a big belly, you first have to have a fatty liver. Now, the simple version of this is that your liver becomes fatty because you're eating too many carbs, and the carbs are being converted into fat in the liver and other places. But the liver is only a certain size. There's only so much fat that you can cram in the liver before it starts to overfill and spill over into other organs outside the fat cell. That's called ectopic fat. Around the organs, that's called visceral fat. So when you see people with a belly, you know they have a fatty liver. And all this is coming from a high carb diet, as well as a person eating many frequent meals, having 3 meals with 2 snacks. That increases the insulin. And insulin is the storage hormone. It will take those carbohydrates and it turns the carbs into fat inside your liver and around the organs. Now, typically, what a person only sees is what's on the outside. They see their belly, but they don't associate any other problems, at least initially. I mean, their blood sugars are usually normal. Why? Because the insulin is taking care of it. The insulin comes in there, takes it out of the blood, so then we can maintain normal glucose levels. So we really don't see the high blood sugar situation for at least a couple decades. And we don't even see the high insulin that's doing all this conversion because the doctor never tests your insulin levels. If he or she did, they would find it would be very, very high. And by the way, there's a great test called HOMA-IR to detect your insulin levels. And so here we have this camouflage situation where the high sugar is being camouflaged by the insulin, and the insulin is working really hard in the background to store all this fat. And so unless you have an ultrasound of the liver, you're not going to detect that there is a fatty liver. All you're going to see is you have a gut. And then as the years go on, as the liver becomes fully filled with fat, and now you start developing insulin resistance. So it takes more and more insulin to lower this blood sugar until the point where the body finally can no longer compensate for all the sugar. And then that's where the blood sugar starts going up. You become a pre-diabetic and then an actual diabetic. So the deeper cause of this insulin resistance is really a fatty liver because the liver can no longer function and everything starts backing up. And you can pretty much summarize the fatty liver to be AKA, also known as a high carb diet. And a lot of people are not connecting the dots between the other symptoms that this high blood glucose and insulin is creating, like fatigue, frequent urination, especially at night, like sleep apnea, like a weakened immune system, like inflammation in the joints, like arthritis, like cravings to sugar, or metabolic syndrome, which is high blood pressure, heart disease, a fatty liver, and diabetes type 2. You see, all of these things and a belly fat is coming from the same thing: high carb diet, high blood glucose, and high insulin. So, in summary, I know your belly fat doesn't look good, but it's just the tip of the iceberg. There's a lot more going on beneath the scene. And so, if you're interested in resolving this, I have a very good solution. It's called healthy keto and intermittent fasting. I put a link down below of exactly what to do to get started. So if you're enjoying my content, which I hope you are, and you're applying this knowledge to your health, and you have a success, I'd really appreciate you sharing your success story. So click the link down below to my website where you can upload your success story so you can help inspire others.